Hello. I'm Dentist Fortune. Please stay till the end. We'll be sharing some very important gems. Today, we're talking about neurodivergent patients and autistic patients in the dental care. So, as always, there's a disclaimer. The information provided on this dental YouTube channel is for general informational purposes only. While we emphasize dental prevention is better than cure, any content shared on this channel should not be considered professional medical advice, diagnosis, or treatment. Always seek the advice of your dentist or qualified healthcare provider. So it's very important that you stay to the end. We'll be sharing some gems. So the learning outcomes is what is neurodivergence, give an example, and then I'll share some dental tips. I'm going to try and keep it as simple. So, what is neurodivergence? Neurodivergence is a term that is used to describe people whose brains work or develop or process information differently from what is typical in most people. So, it comes from combining the word neuro relating to the nervous system and divergent meaning different or off the usual path. So, how can we support people with neurodivergent or autism? So autism falls under the umbrella of neurodivergent people. So it is an example. Autism is an example of being neurodivergent. So how can we support? So I'm going to try to keep it simple and base it on the 5 senses. So that is the sight, the smell, taste, hearing, and touch. These are things that they feel differently. Every child or every person with this personality is different. They all have their own special needs. So if we say sight may be what they see. So if, for example, they come to the practice and they see bright light and things like that, it can affect them. So there'll be instances that someone will enter the surgery and said the light is too bright, because normally we use the surgery light and then we use the overall light in the surgery. So when it happens like that, I tend to turn it off. And then smell, they may not say about the smell, but it's more heightened in them. So maybe smell of the surgery or something like that. Some people don't take well to strong scents, maybe strong perfume. Some people will tell you, they may not tell you, but smell maybe at home or something like that. There are certain smell that can make them feel not too comfortable. Or taste. So the taste could be toothpaste. So the toothpaste that you and I use, in them, they may find it very difficult. They may think it is too foamy, or some of them will prepare flavorless toothpaste. There have been instances that normally there's a tablet we put in the mouth, in the cup. That is a mouthwash for people to rinse with. Some of them may come in and tell you they don't like the mouthwash, and therefore they just prefer water. So everybody is different. And then hearing sounds. So, for example, they may not like the sound of the drill, or they may not like this a noisy waiting area. So it would be best to book them when it is a little bit quiet. And then touch. The touch could be the feel of the bristles in their mouth or the vibration. So some of them may not like an electric toothbrush, because electric toothbrush may vibrate and it may be noisy, make noise. So if you are going to use a manual toothbrush, it should be medium bristles, and please don't go horizontal. You have to use the rule technique. That is, hold the toothbrush at an angle of 45 degrees, and then some of them may not feel comfortable. I've seen some people complaining that, oh, they find it difficult to brush their teeth. So it's just not to, they may not like the taste. Maybe that's why they may not like the taste of the toothpaste. That's why they don't want to brush. So you have to take your time with it. It's very important they brush twice a day. And if they don't brush twice a day and food accumulates, it can lead to decay. So it's very, very important to at least try and help them with the brushing. So sensory overload. So what's sensory overload? So for example, if there's loud noise, bright light, and the smell, all those things can lead to sensory overload, and that can lead to anxiety. So every child or every patient is very special. So you need to find out what they like and what they don't like. So some of them may come to the surgery with a comforter or a blanket, so they say this is Mr. Teddy. So it's very important. They may come in with a comforter. Some of them would like to watch a particular movie to relax them. So some parents, you need the assistance of the parents and the carers. They may know which music they like and they may want to listen to that music whilst they are being treated. So that's very important. So, how do you prepare for autism awareness? How do you become aware? So, what is autism? So, autism is a lifelong neurodevelopmental condition that affects how a person experiences and interacts with the world. It influences social communication, behavior, interest, and sensory processing. So these are some of the things, some of the dental tips. So preparation is very important. So preparing the person before they come to the surgery. So last time I saw a parent coming in with a child that they've bought wooden toothpaste, wooden toothbrush, and a mirror. So they've been practicing at home before they came. So that is very helpful. That, oh, you are going to see the dentist is going to count your teeth and things like that. So, for example, I use the tell, show, do technique. So, what is tell, show, do technique? So, I tell them what I'm going to do, show it to them, and then do it. So, if I'm going to see them for the first time, oh, I use simple words. I'll say, this is the magic chair. This is the magic chair. And then you can have a look at it. This is the magic chair. And today I'm only using a mirror. That's all I'm using. And I'll show it to them. I'll tell them they can feel the mirror and then ask them if they would open wide for me to have a look. I'm just going to count. So we just do the counting. We don't do much on that day. So it's like getting to know them. And then maybe we do the checkup. That is counting the teeth. That's the checkup. And if we have to apply anything, we do it, and that's it. And then they go, and then they come another time. So it is very important to register the child early. For example, at the age of 6 months, or in some children, because we say 6 months, because we believe the first set of teeth appear around that time. But some kids delay, they may come in at 8 months. And I mean, it doesn't really matter. As soon as the child has got teeth, you can register them with the dentist and then start bringing them to build their confidence. So if you start early, it becomes much easier for them. And then they have a routine, then you get to know what they like and what they don't like. So, as I said, some may not be motivated to brush their teeth because they prefer a non-foaming toothpaste, and there are non-foaming toothpaste around. And it's very important to register them early to get them used to coming to see the dentist. And modeling is, for example, if they've got other siblings. So, if they see their siblings in the chair being seen, it encourages them to also be seen. And also, every child is different, everybody is different. So some of them may prefer the light to be dim. Some of them will bring their comforter or a teddy or something like that. So you can even practice on the teddy. Oh, I'm going to count your teeth. And can you also open your mouth? They'll be clutching it. It's comfort them. And then you are able to count their teeth. Okay. So I've always believed in prevention is better than cure. So what is prevention? It is the information I give to everybody. And there's something called normalization. Normalization means there are times children may come in and they may be special needs or they may be neurodivergent or they may be autistic, but the parents will tell you it's only when you start seeing the child and start treating, then the parent will say, oh, they've got a mild form of ADHD or something like that. But this is the information I give to everyone. That is brushing twice a day, limiting sweet to meal times, spitting after brushing. If they have to have, some of them have got special diets, and some of the diets, if it involves liquid and is sugary, then they should use a straw and limit it to meal times. It's very important. And also visit the dentist regularly, because if they are not able to brush properly, so someone who does not is not able to brush properly, even though they may not eat a lot of sweets, they may end up with a lot of cavities, because if you don't brush the plaque away and it stays there, it leads to all sorts of decay. So for example, parents who are breastfeeding, as soon as the baby falls asleep, you need to take the breast out. If they are using a feeding bottle, as soon as they fall asleep, gently take the bottle out. If you leave it in their mouth, it may rot their teeth and it may lead to nursing caries. So prevention is better than cure. Dental tips: register early, prepare them from home, and tell show do technique. Thank you for staying till the end, and please subscribe for updates. Thank you, and see you.